Where X-rays begin to fall short is in terms of three-dimensional structures, because we can see in two-dimensional, great, but what if we wanted to know the three-dimensional structure, or how the three-dimensional structure might differ from what we're expecting to see if we're trying to make a clinical diagnosis? And so that's where computed tomography comes into this picture. And so what computed tomography does is it basically will stitch together, it's all based on computers, but it will stitch together a bunch of different X-rays from a bunch of different angles and put them into a three-dimensional format. So basically, if you took a bunch of 2D pictures and you stack them all up, you could then stitch them all together to figure out what the three-dimensional shape of this thing looks like. And so that is the key principle that underlies CT scans. Now, another thing to talk about with CT scans is that they use contrast agents. And by using these contrast agents, they help us much more easily identify the smaller and softer tissues that are present in a patient. So a CT scan is going to let us not only get that 3D picture, but also have a lot more detail than we typically would have with a conventional X-ray. And so literally the same exact technology, but we're just using some computers here to stitch some stuff together. And also we're adding some contrast agents to help us see structures more clearly than we would with an X-ray. So we're basically eliminating the cons of X-rays, but there is some cons with doing CT scans. And the biggest one here is the fact that when you get one X-ray, you've exposed yourself to a little bit of radiation, but when you do a bunch of X-rays to make that 3D image, you're exposing the patient to a lot more radiation than they would from just a simple X-ray. So that's number one. Number two is that with patients who you administer these these contrast agents to help have better CT scans show up, the problem is that those dyes that are injected are things that the kidneys need to process, and so you're stressing the kidneys in the patient by putting all these dyes in, because your body's gonna have to figure out how to deal with all that stuff at the end of the day. And so that is another exposure to your patients that you will be putting on them when you do a contrast agent in the CT scan. So more ionizing radiation than a typical X-ray, and in addition to that, you're exposing patients to these chemical dyes, these contrast agents that also are things that can affect the kidneys. So those are two considerations taken into place. Now, that being said, another reason why CT scans are very good and why they're used a lot is that they're really fast. So in 30 seconds, these CT scans can be acquired. So if you were in an ER and someone just had a massive head trauma and you needed to know really fast what's going on in this person, what do you need to do, CT scan in 30 seconds is going to give you a great 3D structure of everything that's going on in that head. Where do you have internal bleeding? What bones are broken? Which structures are impacted here? And so it is a very valuable tool that is used very often in hospitals to help people figure out what are the most important things you need to address right now for patients who just had a head trauma, for instance. And so while there are cons, there are pros, and based on the situation, CT does give us some of the best options we can get to figure out what needs to be done in a given scenario. So with that, I'm going to wrap things up. I hope this is interesting and helpful stuff. Thank you all for watching. I hope everyone out there is doing well, and I will talk to you guys next time.